Great. Good morning, everybody. My name is James Weaver. I'm the Director of Performing Arts and Sports for the NFHS. We're very privileged today to have Dr. Neha Raukar here from the Mayo Clinic. She serves in the Department of Emergency Medicine and Sports Medicine. She is a great friend of the NFHS and has an immense amount of knowledge in heat illness and heat illness prevention, as well as a history in the band and music space, which is really good for us. So I'm going to turn it over to talk through with Dr. Raukar. Before I do that, a couple of housekeeping things. If you have a question you would like to ask during the presentation, please use the question and answer or the webinar chat feature. I'll be monitoring both of those throughout the webinar, and I'll be happy to interrupt and have your question asked as we go through the presentation. There will also be a question and answer component at the very end. Feel free to do that. And we have a resource we'll show at the end of the webinar as well for more information on heat illness prevention and marching band. Right now, it's my pleasure to turn it over to Dr. Raukar and lead us through marching to the beat of safety, preventing and managing heat-related illness. Dr. Raukar.
Thank you so much, James and Ken, for this invitation. Yes, I was a part of the marching band 20-something years ago. I played the flute and the French horn. I was very successful in that I could hold that French horn the whole time and never drop it. Anyway, so we're going to talk about heat illness today in the marching band space, something that is a sort of new area of investigation, at least for most of the country. So imagine a scorching summer's day, the sun beating down on the marching band, who is wearing their beautiful, vibrant uniforms. They're pouring out their heart and soul into this dazzling performance. And you're paying attention to every detail, who's out of step, who's missing their cues, and all of a sudden, the saxophonist drops. And the question the public is going to ask is, were you prepared? And so let's talk about what that means. All right, so today we're going to talk about the unique risks that marching band performers are exposed to. We're going to talk about heat illness and give a brief overview of that. And then we're going to talk about some challenges in primary and secondary prevention. So marching band is a physically demanding activity. It combines elements of music performance with synchronized movement and precision, much like football and soccer. It requires participants to engage in all these physical activities while performing a choreographed routine. The difference is they do it for a lot longer. So when we think about the risk of injury that the marching band participant is exposed to, we think about the time that they have to perform, and that's aerobic and anaerobic activity, their choice of clothing, so what influence does the uniform have? And then we treat these participants differently than we do athletes. We don't get a PPE for most people who participate in marching band. There's no EAP or AED on the sideline that's required. There's no dunk tank on the sideline. And often there's no access to an athletic trainer to identify before the event or to manage an event as it occurs. So let's talk about heat and the body. We have a remarkable ability to manage heat, and we're not going to talk about climate change and the effect of the environment. We're going to talk about the body itself. So when we think about heat stress, we think about our exposure and how we retain heat and how we release heat. So it's important to understand the 4 different ways that we are exposed and we can release heat. So we're going to go through these for a minute. It's a little bit of science. So heat can be transferred through radiation, like from the sun, or when you put your hands up against a fire. This is heat transferred by infrared rays. Then we have conduction, which is the transfer of heat through physical contact, right? So you see like the person's foot is on the ground. Then we have convection, which is the movement of air or water over the skin, which helps cool it down. And then we have evaporation, which is the process of turning liquids into gases. So when you evaporate sweat, which plays the most efficient role in cooling the body. So let's talk a little bit about the influence of the uniform. This was my high school uniform, evolved a little bit, but still hasn't changed much in 20 years. So let's go through the parts of this uniform. So you'll see that there's pants and socks, usually a shirt and then a jacket over it, a shako or a hat on top, some kind of thing to prevent you from losing heat from your head. And the colors also are kind of dark, and so you can see it from far away, but they also retain heat. When we look at the choice of clothing, it directly influences the effects of heat loss from the human body. So typically, clothes have about a 50% fiber to air ratio. There's a whole science behind this. So about 50% of the fibers are laying against the skin. The more flat fibers are, like you can see cotton, the more in contact with the skin the fibers are, and so you increase conductive loss. When you have crinkled up fibers like wool and polyester, you're trapping more air, and when you trap more air, you have less conductive loss. So you're actually heating up the body. Our uniforms were made of wool and polyester, and so we were trapping a lot of heat. So just think about what your uniforms are made of. So now when we think about heat loss and retention in marching band, and you think about the uniform that your participants are wearing, let's think about how each of the effects of how they're losing this heat. So we can talk about conduction, the transfer of heat through physical contact. So like I said, the flatter it is, the more conductive heat loss you have. We can talk about convection, and you know that when you're holding in, you're trapping the air, then you have less heat loss through that way. We can talk about radiation, which is heat transferred by the infrared rays. So think about your practice surface, and again, your choice of clothing. And then how much evaporation are you allowing based on how much of their body is covered with clothing. And so each of these decisions that we make for the marching band participant influences how they can retain or lose heat. So now let's talk a little bit about heat illness. Heat illness we think of as a spectrum of disease. And so you have mild kinds of heat illness, and you can have very severe kinds of heat illness. So the most mild is something called heat rash, where you have small little red bumps on your skin or on different parts of your skin. And that is just because of clogged pores. That's easily solved by just using an exfoliant. Then we have heat cramps. These are the muscle cramps that you feel when you're outside mowing your lawn. And this is typically due to dehydration or your hydration status walking into your job that you're doing outside, playing a sport or marching on the band. Heat syncope is very common. It's exercise-associated collapse, and it's due to the fact that all of your veins are dilating, trying to lose the heat, but because your blood is now not reaching your brain, you're going to collapse. And so people have this prodrome where they feel lightheaded and they have some tunnel vision and they pass out. Heat exhaustion and heat stroke, we're going to focus a little bit on these because these are the ones that we're worried about. So heat exhaustion occurs when your body loses excess amounts of water and salt, typically from sweating. On the other hand, heat stroke is the medical emergency. And that's the one that time is the amount of time it takes for you to treat them will determine if the person lives or not. So heat exhaustion has things like nausea and vomiting, excess sweating. They look pale and sweaty. They're complaining of muscle cramps, and they feel faint or dizzy. Versus heat stroke, they have a throbbing headache. They stop sweating. That is typically taught as the defining line between heat exhaustion and heat stroke, that you stop sweating. The thing is, you were sweating up to that point. So when you go to touch the patient or touch the athlete or touch the marching band participant, they're going to be wet because they were sweating to that point. So you can't, hold their hand and say, oh, they're sweating, it's not heat stroke, because you can't tell. You don't know if they're actively sweating. They also nauseous and vomiting. They have a very rapid and weak or strong pulse, and they often lose consciousness. When we think about the things that affect our ability to sweat, there's actually books out there. This one by Sarah Everts is actually kind of interesting. It's The Joy of Sweat. She talks about all the science behind perspiration. But the things that are interesting are, she talks about the things that influence our ability to sweat. So for example, genetics. We know that some people are just better sweaters than other people, and some people just don't sweat. One's fitness level, people who are more physically fit tend to sweat more efficiently. Medications, I want to bring this up, medications and medical history, because I think this is a big thing right now. A lot of our students in the middle school and high school space and the collegiate space are taking medications for ADD or ADHD or anxiety, and all of these medications influence, and by that I mean negatively influence, our ability to sweat. But even blood pressure medication affects how we sweat. And so having an idea of what medications the participants are taking plays an important role in their risk profile. The other thing I'll mention is energy drinks. The kids are all drinking bubbler or Celsius or things with caffeine in it, and that all also negatively influences our ability to sweat. So when we talk about heat illness in sport, and the reason we talk about it in sport is because that's where we have the data. And then we take that data and we try to extrapolate it to the marching band population. So we see by sport, the overall heat illness rate by 100,000 athlete exposures. And this is data from high school Rio. And we know this inherently. Boys football has a lot more heat illness rates than girls track and field. And often it's because of the uniform or the outfit they're wearing, but also the time outside, the time of the day they spend outside. And then when we look at the types of heat illness that people succumb to, we see that exhaustion is very common. Heat cramps, we talked about, that's very common. Heat syncope, so that's passing out from heat. But then all other things like dehydration, but you see that about 1% have heat stroke. And then what do? What happened to these athletes when they succumb to these different illnesses? So most of the types of aid, these are reported by the athletic trainer. So these are only schools that have an athletic trainer who's taking care of them. And so most of these interventions were performed by the athletic trainer. About 15% though were performed by the coach. And if you don't have an athletic trainer, then you're performing these interventions. So in general, they're removed from play. They're given fluids by mouth. They're cooled by towels or ice bags. And we'll talk about what's the most efficient way to cool somebody. Their equipment is removed. They're moved to the shade, or they're taken to an air-conditioned location. Some went to the hospital. Some were given IV fluids either on the sideline or in the hospital. Cooled by an ice bath, so dunking the patient, cold water immersion. Cooled by fans. Some of them received no aid. And so this is sort of a broad array of different interventions you can take. We're going to talk about primary versus secondary interventions. So primary intervention is prevention. It's the thing that you do to prevent the incident from happening, preventing a bad thing from happening. It's like vaccines. It's like using a wet bulb globe. Secondary prevention is what you do once the person has the illness, how you prevent its progression. So primary interventions would be acclimating the patients or the athletes or the participants, hydrating them, and knowing your environmental conditions. Secondary would be cooling them appropriately and using an emergency action plan. So I mentioned the word acclimate, and we know that athletes go through this period where they acclimate to the warm conditions and they become more efficient sweaters, people who sweat, versus marching band participants don't typically have a defined acclimating period. But we're hoping that maybe we can figure out what that period should look like. Because we know that nobody knows the value of water until they join the marching band. So let's talk a little bit about hydration. I didn't know this until James told me this, but it seems to be, and I remember it from high school, hydration really does matter and how well you perform. So let's talk a little bit. So like I said, primary prevention involves hydration. And we have all these rules for athletes about when they should hydrate and how much they should hydrate and how much water they should drink. And for every 15 to 20 minutes of exercise, you should be drinking a couple of ounces. And also we should be filling up the tank after exercise. There was a study done in South Carolina that showed there was a marked difference between hydration status, fluid intake, sweat, and thirst amongst band members. And they found that the people who were at highest risk for collapsing were also the most dehydrated. And they showed that hydration status could be, you can figure out somebody's hydration status pre and post event just by their symptoms. And so this plays a very big role in how an athlete will perform and how they will respond to heat illness. So how do we measure temperature? So we have 3 ways right now to measure temperature. So we can use a thermometer, and that tells you about regular air temperature. It's a static number. It tells you what's happening at this moment in time, just in the air. Then we evolved to use the heat index, which talked about not just the air temperature, but also the humidity. The unfortunate thing about the heat index is that it's measured in the shade. I don't know about you, but our field where we practiced was not in the shade. So it wasn't really as relevant for me when I was out in the sun. And then finally, now we have the wet bulb globe, which is a complicated equation, but it takes into fact not just the air temperature and not just the humidity, but it looked at things like radiation and the sun coverage and cloud coverage. And it told you exactly the amount of heat stress anybody is exposed to. So what is the difference between the wet bulb globe temperature in this first column and the heat index? Because people try to use heat index as a proxy. It's not perfect though. One's measured in the sun, like the wet bulb globe, right? You measure it where you're going to be. You take the little instrument and measure it where you're going to be. The heat index is measured in the shade. They both use air temperature. They both involve humidity. One also looks at the influence of wind, right? Which affects your ability to sweat and affects radiation and conductive losses. And one takes into account cloud cover, which also affects how much heat exposure you're having. So the wet bulb globes gives a pretty accurate view of what your heat stress is. So when we take the wet bulb globe or the heat index, we try to figure out what zone we are in and how much stress that we are exposed to. So let's look at the wet bulb globe. Like I said, it takes into account your air temperature, your humidity, your radiation, and your wind. So why does this matter? Well, that's one part of the equation, your wet bulb globe. How about where you're playing, where you're practicing, where you're rehearsing? So let's look at 11 o'clock in the morning on a Saturday morning. Let's look at the air temperature you'll see in the middle is the blue. It's 92 degrees outside. The temperature, if you were standing in the grass, in the shade, is 85 degrees. If you're standing in the grass, on the grass in the sun, it's 98 degrees. That's kind of a marked difference. If you're on cement, it's 105 degrees. That's what your person is exposed to. If you're standing on bricks, it's 115. And if you're standing on blacktop, it's 121 degrees Fahrenheit. That is the amount of stress your body is being exposed to. But where do most of us practice? On turf. So let's talk about turf for a second. If we look at the temperature, an ambient temperature of 95 degrees, on natural grass, you'll see it's 105 degrees, but on turf, it's 170 degrees. Now, why does this matter? The temperature to burn your skin is 120 degrees. So at 170 degrees, you can imagine the amount of radiation coming off and touching or affecting your body. But imagine that you put your hand on that. You'll blister within 2 minutes if it's 170 degrees. So this is something it's really hot. It's something that's going to affect the performance of your participants. So what do we do with all of this data? So for a moment, take a look at this map and find your state and figure out what category you're in. So I'm currently in Minnesota. So I'm category 1, almost category 2, but I'm actually category 1, okay? And then when we take the wet bulb globe, it will tell me my conditions based on category. So category 1 obviously we can't tolerate as much heat as category 2 and category 3. And these recommendations were, again, extrapolated from athletes and what we do, how long we can train, how many breaks we take, how much we should hydrate, things like that are informed from your category. So that's primary prevention. That tells you the boundaries by which you can practice or play. Secondary prevention is what you do to prevent death, basically. Once a person has heat stroke, how are you going to prevent them from dying? You have 30 minutes. 30 minutes is the time to death. So we know, we've seen numerous times, if we delay more than 30 minutes to bring their temperature down by a significant amount, they will have liver failure and kidney failure. The brain is cooking this whole time and they will die. So we think about the different ways to prevent death and how do we cool people efficiently. And so this is from the Corey Stringer Institute. They did this beautiful study where they looked at the rate of cooling by different methods. And so you'll see, looking at this, ice packs, which is what we do so commonly on the sideline. Ice packs cause very little change in their core temperature. the reason I put this talk and put this picture in every talk is the helicopter downdraft, which I think would be very dramatic, is actually not so much. It's about 0.1 degrees Celsius per minute. So not that dramatic. But here's what we always want people to do is cold water immersion or ice water immersion. Look how dramatically this lowers temperature. I don't know if you can see my cursor, but look how dramatically this lowers temperature. It's the quickest way to lower core temperature. And so, you know, for athletes, we have a dunk tank or a kiddie pool on the sideline, but we don't really do that for all marching bands. Here's what we have at our marathon, a little aluminum dunk tank that we put people in. But really what's really important is the emergency action plan, right? So it's easy to say, oh, I need this, and oh, I should have access to this, and I should have this, and I should know the number to EMS, but who's gonna do it? So I like this picture when I think of teamwork. This is the dream team because these players thought that they were gonna beat some NCAA team, but they lost because they had not worked together. And so before every practice, before every game, I always just go through what's going to happen if something bad happens. Who's going to do CPR? Who's going to retrieve the necessary equipment? Who's going to call EMS or flag them down? Who's going to take care of the rest of the team? And who's going to dissuade all the nosy people, the looky-loos that want to see what's going on? And so in the emergency department, what we do, this was obviously during COVID, we had a hot patient, a heat stroke come in. They were unconscious. And you can't really see for patient privacy reasons what we were doing, but we put tubes in both of their chests to cool their lungs down. We washed it with cold water. We put a tube in their bladder and cool that down, lavage it with cold water just so we can bring down their temperature. Sometimes we'll make a little hole in their belly and put some cool water in there to try to bring down their core temperature. And so we try to do all these invasive things when on the sideline, it would have been just so much easier if somebody just got dunked. So we're trying to avoid that. The pearls are, even though high school football accounts for most deaths due to exertional heat stroke, we don't actually know what the risk is or what the rate is in marching band, especially at the high school level. Once heat stroke occurs, you have 30 minutes to cool the patient. Prevention takes many shapes, but really it's important to know what heat stresses the body is exposed to and how are you going to mitigate these. Death from heat stroke is absolutely preventable before they even come to the emergency department. And we should be using a wet bulb globe to help guide our practices and games. And we should really be practicing an EAP, and we should all have one, even for marching band. And the wet bulb globe, the NFHS Foundation had a couple of waves of distribution. And so I think James will put in the chat and on the website, Davis Whitfield's email address. And if you're interested in purchasing one, he will connect you to the right people. And I will challenge you when you go back to your schools, consider the unique aspects of what your marching band participant is exposed to. Identify some areas of intervention. Identify areas of intervention to reduce heat illness, so primary prevention. And then if something happens, identify what you're going to do and write these down and make it an action plan. Thank you.
All right. Thank you, Dr. Raukar. As we can see, very important information here. And I love the stat that it is 100% preventable for this heat illness, especially if you have planning and effort ahead of time. That's really important. So what I'm going to do here is I'll put in the chat. We have a landing page for you on heat illness in marching band. This has all the resources that Dr. Raukar covered today in the webinar. Please go ahead and use that website, share it around. I will talk to Davis more about how he wants anyone to contact for wet bulb globe thermometers. The NFHS Foundation has been very generous in that, has already distributed over 5,000 wet bulb globe thermometers to high schools across the country. So there's a good chance your school or schools in your state already have them. And if that's the case, we do say that the wet bulb globe thermometer should be used for all outdoor activities. Davis has been very clear on that, as well as he serves as the executive director of the NFHS Foundation. So it's very clear that we are using it for all outdoor activities, and that includes marching band. All right, so we're going to go to the Q&As real quick and see if there's any questions or comments out there. So we have one, does the resource show how to calculate the wet bulb globe thermometer temperature?
If you have a wet bulb globe, it just gives you the temperature right there. You don't have to calculate it. It's all internally done and it will calculate it for you.
Yeah, they're pretty amazing machines. Great. Does anybody else have any questions or comments as we wrap up for the day? All right, so this video will be found probably next week under the link that I shared in the chat. So feel free to get that link and check out those resources whenever it's convenient for you. Pass it around. This is a very important message. We really wanted to get it out this spring as marching band directors are starting to prepare for summer, for late spring and summer rehearsals, that they take these into account. There's some very easy things they can do. They don't cost a lot of money, but if we can save children from having this kind of an issue, every dollar put towards it is worth it, in my opinion. So, Dr. Raukar, thank you very much for being here today. If there's anything that you'd like to close us out with, feel free to do that, and then we'll end the webinar.
This is totally preventable. Having a good plan works, having a wet bulb globe, so think about primary and secondary prevention, and it is totally preventable. So we'll get more data in this space, but in the meantime, we can extrapolate from the athletes and bring it to the marching band.
Great. Thanks so much, Dr. Raukar. Everyone have a great and safe spring and summer as we get into marching band season. And if you have any questions, by all means, contact the NFHS at any time. Thank you so much.